So without further ado, my name is Dr. Rhonda Dailey, and I'm an assistant professor in the Department of Family Medicine and Public Health Sciences. Also, I'm the scientific director to the Office of Community Engaged Research and part of the steering committee for Checkup. And my lovely counterpart here is Dr. Vicki Sapp. She's going to talk to you a little bit today. Can you please go to the next slide? And I just want to talk about my positionality. I have Dr. Sapp to introduce herself. I'm originally from the South. I'm from Mississippi. I grew up there, so I have a lot of ancestors from there, and we've been here in this country for a long, long time. My grandfather is part American Indian, and growing up in the South, I've seen a lot of things and experienced a lot of things. I'm a mother of two actually young adult children. And my passion is to actually speak about things related to health disparities with women and also African Americans. Without further ado, Dr. Sapp.
Good evening, everyone. Thank you so much for inviting me to speak. You know, my life work is on implicit bias and really looking at disparities in healthcare. And, you know, when we talk about my positionality, I think about that. I'm first generation, 3 times over undergrad in my graduate program. I'm a cis Black woman, low income, single mother household, South Bronx, New York City. And so really looking at a number of things. So when we talk about, and I'm just going to transition, if you want to go to the next slide, what is our why? Our why and why we do this work is so important. When we talk about the social determinants of health, when we talk about looking at the focus of trainees, next, when we talk about looking at trainees, so when we talk about those social determinants of health, those 5 areas: economic stability, education, social and community context, health and healthcare, neighborhood and built environment. And the biggest thing for me that really resonated was when most of the health organizations decided to make discrimination, racism, stressors, public health issue. It's a crisis, right? And so when we talk about health outcomes, the intervention through education is what we do, and then focusing on the teachers, the learners, and the healers. Very important, very. Next slide. So what I've done at my position at Geisinger Commonwealth School of Medicine, I was an assistant professor there, and I infuse my 3-part implicit bias series in the curriculum from the first year to the 4th year. And I started this back in 2017 when I got hired there. I'm still an adjunct professor. Right now, I'm the chief diversity officer at another institution, but really beginning to start doing virtual and in-person training and really doing train-the-trainer sessions. So I've done stuff at other institutions. So you see Nestor is on there, 18 trainees, 25 trainees for whom Henry Ford medical group, and I'm actually scheduled to come on November 8th in person to do 75 more trainees. So these are clinical faculty, academic faculty, and so I'm very excited about that. In 2020 to 2021, I've done some training at Nebraska, as well as Geisinger graduate medical education. And one of the things that I left off here, it's here, right here. In 2019 is when I started doing some training for Wayne State, just to give you that little background, and also the University of Texas at Austin. And I've done a number of other trainings as well. So really trying to train people to understand implicit bias and how it shows up in healthcare. Next slide. And June of 2019, we had 21 people train in the microaggressions curriculum at Wayne State. We hosted It was hosted by the Office of Community Engaged Research. We had 1 day of training. We had 3 virtual follow-up sessions. And Dr. Dailey has really led the charge on this. And she's going to show you some of the pre and post assessments from individuals' experience in that. Dr. Dailey?
Thank you so much, Dr. Sapp. And I just wanted to say, one of my long-term goals was to introduce implicit bias by conducting workshops for various organizations and groups within and outside of Wayne State community, and help to bolster this also. The 3 of us, Dr. Sapp, me, and Dr. Oparo, were members of the Michigan Governor Gretchen's Whitmer's implicit bias training rules advisory work group in 2020. Although we had already started this implicit bias work, it was that that led us to make sure that we had our certificates. Please, the next slide. All right, so a little bit of background about what happened in 2021. So while we're still in the pandemic and doing a lot of our virtual events, we had 18 virtual workshops for the medical students and also the faculty at the School of Medicine here. So it was 15 medical student workshops. So that's 3 workshops apiece from Dr. Sapp's curriculum, which had a part 1, 2, and 3. So that was in partnership with Dr. Sapp and the Office of Community Engaged Research. So the sponsors were at the School of Medicine, the Office of Faculty Affairs and Professional Development, and also the Office of Undergraduate Medical Education, which educates our medical students. Wayne State has the largest medical school class in the country with over 300 students per class. So it's a lot of students, probably twice as much or 3 times as much as regular medical schools. So this is a picture of one of our flyers that we use for the medical students. So we had the workshops in the spring, later in the springtime, also in the fall. So please, next slide, please. All right, so yes, so there was a total of 1,204 attendees. 115 were faculty, that's 9.6%. And of the classes that we have, you can keep going. We had 179 MS4s, MS3s, it was 31. It was not required for them. The class of 2023 and 24 and 25, it was required. And you see almost all of the students attended. We had a good number of students. So please, next slide. And as far as the faculty demographics for workshop number 1, so we had a pre and post assessment for every workshop. And the pre-post assessment asks questions like, what was your knowledge beforehand? What is your knowledge now? So we're going to look at those results in a bit, but this is the demographics where we had 55 faculty to complete a pre-post assessment, and they all lined up. And most of these were females, 76%. Ages range all the way from 21 years old all the way to 70, with the majority of them, about 36% of them between the ages of, 50 to 60, 51 to 60 years old. They're faculty members. Okay, next slide, please. So as you see, there was 27 people that we can actually get a pre and post assessment and determine where their knowledge was. So we asked the questions, what is your knowledge of what microaggressions are, how to interpret them, the different types of bias, what privilege groups are, what are allies and accomplices. And then we asked them after to think about their knowledge right after the workshop. And as you see, we had a significant increase in knowledge with a p-value of less than 0.05 for the average scores for these, and it was a Likert scale from 1 to 5. Next slide, please. And the demographics for the medical students. So we had 825 medical students to complete a pre and post assessment. And as you see, that's the racial background, the majority being white, and 23% being Asian. And then we have the other racial background. Again, a lot were female, close to 54%. And of course, they're going to be younger, between the ages of 21 and 30. Next slide, please. So again, we see that, again, the knowledge has increased even for the medical students as far as what microaggressions are, how to interrupt them, the different type of biases, what privileged groups are, what allies and accomplices are. Next slide, please. So then we asked the question for faculty, well, what are the 3 things you learned from the session? One faculty member said importance of, can you hold off for the, okay. One faculty member said it's the importance of bringing bias to consciousness, and implicit bias training does not have to be boring. They also said that many people at the program feel uncomfortable speaking out against the majority opinion or superior faculty, and it helps to know that others feel similarly and that I'm not alone. And so what could be improved for it? They said they wanted more time. They wanted 3 hours or more. And I know Dr. Sapp, was working hard to confine everything into 2 hours for our workshops, but people really did want more time. And they actually wanted more workshops. They wanted regular workshops 1 year after hire, then a year after tenure, then joining leadership. And I think that's a good idea. So what would you recommend? Who would you recommend this session to? All faculty, students, and trainees. Can you advance it now? All right. Then one person talked about how important it is, you probably can't see this, to focus on individuals with disabilities and how it's important to be seen. It's important to be seen. And Dr. Sapp focused a lot on that, the importance of that, and how everybody needs to be included. We can go to the next, advance a little bit more. Now, how do you plan to apply what you learn? I plan to be more in tune with all I interact with and listen more as well. Training for administrators and committee members, clinical supervisors, faculty, so that we can all share a common language and to be working toward a common goal. Love it. And the next one is how I approach microaggressions. All right. And as we keep going, let's talk about some students right quick. Again, we ask the same questions, just advance it. 3 things you learned. The students learned a lot, and we can keep advancing it because I know that we're running out of time now. I love the session. They learned about privilege. So you can see all of these wonderful quotes. These are direct quotes from the students. Keep going, please. All right. All right, what can it be improved? Again, they wanted more time. They wanted at least 3 hours in the sessions. Keep going. All right. Who would you recommend to take it to this session to? The one in the middle, faculty, chairs, leadership at Wayne State. This really needs to be presented to the chairs meeting and are made mandatory. Let's go to the next question. And how do you plan to apply what you learned? I love it that they said that they're going to learn it to actually interact with their patients. I will likely use it every day that I'm seeing patients. I love that. And that's the importance of these workshops. Not only do you learn, but we want you to apply what you learn so that it can affect your patients. Your healers. These are young healers who are going to be physicians, who are going to have their own patients. Next slide, please. So what are some things that we learned about this? It's feasible to conduct it to have a virtual workshop and it be impactful, even though it's virtual. And this is with teamwork, which makes the dream work. It's critical to have staff and time to organize. Technological advances using Zoom. It increased efficiency. It's efficiency for facilitation, and it's convenient. And then we use Qualtrics for the pre-post assessments, which was great. And it gave us an objective documentation of the knowledge and feedback. So we also had an energetic and dynamic speaker, plus activities. And this made the students and the faculty more engaged. Keep going, please. Next slide. What else did we learn? Okay, both clinical and faculty and students showed a significant gain of knowledge. The workbooks were essential. The use of more facilitators in the breakout rooms because they were hard to come by sometimes. Levels of independent engagement depended on comfort level. And of course, again, we covered Michigan's LARA implicit bias training requirements, and over 1,200 certificates were distributed, and up to 6 hours of credit was earned by all the attendees. All right, and what we're doing now, how we're implementing this now, we are doing implicit bias works for our grant activity for the Achieve Greater grant, where all of the PIs, co-Is, administrators, staff, pilot investigators, and the advisory council all attend these workshops. We already had a session 1 and 2. We're conducting session 3 now. And again, we're using the pre and post assessments, and everyone does get their certificates as well. So next slide, please. All right. If you want to contact us, this is our information. And Dr. Sapp, let's just continue to go for the next slide here. All right, Dr. Sapp.
So what Dr. Dailey and I did was we put some resources together, and you can just advance it while I'm talking. We put some resources together of books that you all can go into. Keep going. Just keep advancing it while I'm talking. We put some books together. We put some movies together, some videos, TV shows you can watch. We also put some activities together. If you want to do some activities with your in the clinical space with your team, keep going. Yes. So these are different activities you can use to continue the conversation. So after you take my 3-part series, it doesn't end there, right? It really doesn't end there. You have a lot of access, and we're going to create a platform to try to get these resources to you, the books, the movies, the TVs, as well as the different activities in which you can engage individuals. Thank you so much for listening to that. And we're trying to do our part by making the invisible visible, right?
Thank you so much, Dr. Sapp.